Hey everybody, this is Mr. Calvary, your course coordinator for NU361, and I just wanted to make a quick video today talking about your largest assignment that you have coming up for this class, and that is the physical assessment, which is due in mid-November. This, again, is going to be the clinical component of your course, and again, it is something that you have to make at least an 85% on it in order to pass. And we'll talk about that a little bit as we go along. Let's first of all go into the module here in Canvas. And let's talk about the physical assessment itself. First of all, scrolling down, we come to the module here for the physical assessment, and let's look at the physical assessment checkoff. So let's look at the physical assessment itself that you're going to do. We're going to open this up in its Word document. You make that available to you. Okay, so we have this here. Okay, this physical assessment, this is the form that you guys will use to complete your physical assessment. There's three parts to this form. The first part is what you see here first is the history, okay? So this is the history that you're going to do on your patient before you do the assignment. So we're going to have two options, live or on video. We're going to talk about that in a moment, but you will have this, if you come here and do it live, you will have this entire history done before you get here. And if you video it, you will do this before you video it. So in other words, I don't want to see you doing this on the video. Okay, and it's just a basic health history of your patient. You go down through here and answer all of this. One thing to note is that if this is a completely normal patient, you won't have anything documented on the actual physical assessment form after this history. If you do, though, find something that is abnormal here, such as the patient says that they have a murmur or whatever, you will need to address that in the physical assessment form. Okay, so the health history, you're going to go through family history, everything with them. That's worth 20 points. Okay, after that, you then get into the actual physical assessment itself, starting here with the head and face. Okay, we work this through systems. The first is the head and face, and then you see out here under the head and face, and we even say with the patient sitting, everything that we expect you to do. I highly suggest you use this guide here as this checkoff sheet as the guide to your physical assessment. This is the actual form that we will use to grade you by. So when you turn your video in, I will pull up an electronic version of this very checklist right here. And as I watch it, I will give you points. So this is the exact form. Basically, think of this as the answers to the test. You just have to make sure that you do everything. Also, we do this in a very logical order. So do your physical assessment in the order of this checklist. First thing you're going to do is head and face, and it tells you what to do here. Inspect skin of the face, inspect and palpate the scalp of the cranium, and on down. Goes from that to the eye. Follow this exactly in this order pretty much. Again, it's a very logical order, and it makes grading it so much better, and it also helps to make sure you get everything done. Okay, you're going to work your way through this. Under each thing, it tells you how many points. As you scroll your way down, you see that this is a total of 153 points for the actual assessment. Okay. After that, you get down to documentation, which is worth an extra 10 points. For the documentation, we ask that you document 10 different things. Okay. Just document those 10. You can document 1,000 other things, but you won't be graded for that and won't be given extra points. So we're going to grade you just on these 10. I even give you, we're going to look at later, I even give you a sample of documentation of this. But anyway, just document those 10 things. The total thing is worth 163 points, 153 for the checkoff in history and 10 points for the documentation. In order to pass this, you have to make 85%, okay? If you do not make 85% at least, you will not pass this physical assessment and you will have to redo it, okay? So my suggestion is, after you make this video, you use this actual sheet right here to grade yourself, okay? Grade yourself. If you get through it, and I think 85% of 163, if I'm not mistaken, is 139, okay? If you grade yourself and you're well over 139 points, but you left a couple things out here and there, I would not redo it, because again, this is a clinical. It does not count towards your final grade. This will not change your grade at all, but you have to make at least 85%. So if you graded yourself and you left out 4, 5, 6 things and you figured you made right around 90, 92%, I would not grade it again, because 92% will pass just as well as 100%. That being said, if you're real close to that 85%, there are about 20 different people that grade this, and everybody grades a little bit differently, some harder than others. If you're close, you may want to think about it, because if you're not successful on this, you will have to come to campus and do the redo live. So you need to make sure that you get it right. Okay, so now let's talk about the number one, the patient that you have to have for this. Whether you come live or you do it on a video, you're obviously going to have your patient. The patient can be anyone that you know. It can be another student, it can be your husband, it can be your wife, it can be your neighbor, whatever. It just has to be an adult-sized patient. Okay, I don't so much go by age, but it has to be an adult-sized patient. So you can't do this on a 6-year-old, on your 6-year-old child or niece, nephew. It has to be at least an adult size. If it's a 10, 12, 13-year-old and they're an adult size, that will be okay. But it does have to be an adult size, a patient that you would do an adult type assignment on. You have 2 options with this. You have 2 options. You can do this video live, or you can put it on video and send that and upload that video to YouTube and send me that link. I will talk about in more detail about that as we go on, okay, a little bit later. The settings, where are you going to do this? It would be really great if you have an actual clinical type setting. So if you work in a hospital or clinic and they will allow you to maybe use an empty bay in the ER, an empty room on the floor, something like that, that's very good. You don't have to do that. The advantage to doing that, though, is that you have the bed that you can raise and lower, and you have everything you need to do, and it just works out very well. So if you have access to that, that's great. If you don't worry about it. You can do it in your home. You can lie the patient on a bed, on a sofa, whatever. Just try to make it as much of a clinical type setting as possible. Okay. For you, as far as how you should dress like you are a nurse doing this. So you can wear nice scrubs, a uniform, or if you don't want to do that, you can wear professional dress with nice clothes and a lab coat type setting. Just be very careful. We have in the past had people who are very lax about that, especially if they do it in the home. So again, you have to be dressed professionally. Do not have shorts and a t-shirt on when you do this. That sounds silly to say that, but I've had that happen. So make sure you dress appropriately. Okay. Equipment. You really should not need to buy anything for this. Okay, the only actual equipment that you need, you're going to need a reflex hammer in order to do the reflexes. Typically, you can borrow a reflex hammer. If you work in a hospital, your education department or somewhere like that will have a reflex hammer that you can borrow. If you live here locally, we have several here on campus, either at Columbus or here in Tupelo. We will be happy to let you borrow those. Worst case scenario, you absolutely can't find one. Do not spend a lot of money. If you go on Amazon, you can find reflex hammers for around $5. Okay, so don't spend a lot of money. Uniform stores has them as well. You might pay a little bit more there, but you can find them off Amazon, somewhere like that, very cheap. The other thing you'll have to have is a Snellen chart to test eyes. You can find that online. If you just type in free Snellen chart, you will find dozens and dozens of them that all you have to do is print out. Okay, we've talked about dress for you, that needs to be a professional type dress. So let's talk a little bit about dress for your patient. We've said the patient number one needs to be an adult size patient. Okay, as far as dress for the patient, it's very important that we are able to see what you are assessing. Okay, you're not going to have to assess anything that will cause you to expose the patient. There are no breasts, genitalia, anything like that. But that being said, when you tell me that you're assessing the skin of the chest, the skin of the back, the skin of the legs, we need to be able to see that. So you need to dress where that can happen. For female patients, again, there should be no reason to have to expose breasts or anything like that. But again, we need to be able to see. You can do something like a loose fitting like tank top where you've got access above the breast, and then you can raise it up to assess the abdomen. And then on the back, you would again have access to the top, the upper part of the back with a tank top, and then you could raise it up for the lower part. Quite honestly, the best thing for a female patient is to wear a full size like sports type bra. They offer full coverage. They're very modest. They don't expose anything. They offer full coverage, but you do have good access above the breast line and then to the abdomen as well. So something like that works well. Again, if you're not comfortable with that, you can do like a tank top or something where it can be lowered and raised. As far as the legs, it needs to be short. We need to be able to see the skin of the leg from at least the knees down. For male patients, that really doesn't cause as much of an issue if they're not comfortable taking their shirt off. Again, you can do the same thing with a loose-fitting t-shirt or shirt that can be raised or lowered. But again, when you say that you're assessing the skin of the back, you cannot be assessing the skin of the back through a t-shirt because you can't see the skin of the back like that. So for this, what I'm saying is you are not acting like you're doing a physical assessment. You're going to be a nurse performing a physical assessment on this patient, and someone happens to be videoing it. Okay, so let's talk about preparation for this. Let's again go into the Canvas here. And go to modules. Okay, when you go here under the physical assessment, check off module, you've got everything that you need in order to complete this physical assessment. Number one, you have got your book, which goes in great detail about techniques for this. In addition, I'm not going to open this, but right here, I have a long PowerPoint. There is a slide on that PowerPoint of every single assessment that you do for this physical assessment. In addition, down on the bottom right corner, it has a picture of a microphone. If you click on that microphone, it will talk to you about the information that's on that slide. Okay, you have a physical assessment content module, which again gives text. It tells you in text form everything that you need to do for this physical assessment. Okay, you have the checkoff sheet, which I've already showed you. And then the biggest thing that you have right here is this physical assessment video. Okay, this is a video that I did last semester on a live patient using the exact sheet, the exact form that you're going to use. So I did the exact physical assessment that you will be doing on a patient, and I walk you through everything and I talk our way through it. Okay, there were also some people in attendance and they asked questions. You may or may not be able to hear all of the questions, but you will at least get the answers that I said. Again, it's about 30 minutes long. It's a little bit long, But I highly suggest you take the time to watch it because I do the exact assessment that you do, and I show you the techniques, how to do everything. So I highly suggest doing that. Okay. Back under the modules, additional things that I've given you to help with this. I have got some sample videos here. Now this one up here was a video that I did. I highly suggest you watch that. Then I have some professionally done videos here, which goes through every single system that you will be going through. Okay, these are again done by a professional. The videos are great. They're a little bit long if you watch each of them, but they have got everything you will need to do, plus more. The only thing about this is these assessments, this nurse practitioner in this case does much more than you need to do. The only thing that you will be graded on is what is on that checklist. She or he, whatever the case may be in these videos, will do extra. Okay, that's fine and good. You can learn from that, but just realize those extra things you will not be doing. So just if you watch these videos, just ignore the extra part and concentrate on the things that they do that you need to do. These are good for learning your technique. Okay, back under modules. Again, we said that you have two options for this, okay? You can come to campus and do it live, okay? If you do it live, you'll need to bring your patient with you, and it will be performed here live while us, the instructors, watch you do that, and you'll be checked off as you go. Some of you want to do that live close, and that's great. We would love to see you. I'm assuming the vast majority of you, though, are going to want to video yourself doing this and send it in. Okay, so what we're going to do is you're going to video this, and you will upload that to YouTube. So I've got a whole another module here which walks you through how to set up YouTube if you've never used it before, how to record videos longer than 15 minutes. This assignment will be longer than 15 minutes. If you do this and your video comes out to 8 minutes, I assure you, you need to relook at that video because you did not get everything in there. So just, average video for these are anywhere from probably about 15 minutes up to around 25 minutes. Okay. Anything less than 15, you may not have gotten it all in. Okay. I've got a video here that shows you how to get something to YouTube from iPhones, from Androids. Sharing this on YouTube. When you put this to YouTube, you can do it one of three ways. It can be public, private, or unlisted. You want to do this as unlisted. When you do this as unlisted, the only people that will be able to see this video will be anyone that you send the link to, or in other words, me and the faculty here. Okay, no one else will be able to see it. If someone searches for your name or searches for health assessment video, it will not show up. Okay, do not list it as private. If you list it as private, even if you send me the link, I won't be able to see it. Okay, you can list it as public and I will be able to see it, but the only thing about listing it as public, if you list it as public, it is just that. Anybody in the world can watch it. It will be available for searching. So you probably don't want to do that. Do it as unlisted. Okay, we talk about setting up a YouTube channel. Your YouTube channel does not have to be yours. I'm just concerned with you getting this to YouTube and getting me the link, okay? You already have a YouTube channel because if you have a Google account, that is what will sign you into YouTube, okay? Your MUW account is a Google account, so you have that. But if your son or you already have a personal YouTube account, your husband has one, your children have a YouTube account and you want to do it through theirs, that's fine. All I'm concerned about is you being able to get it onto YouTube and getting me that link. That is the easiest for us to watch. Okay, so that covers everything there. Now, let's talk about if you're going to do it live. If you're going to do it live, well, first of all, if you're going to do it on YouTube, it's due on November 13th. The link to your video is due at 3 p.m. on November the 13th. Okay, if you're going to do it live, we allow you to do it that entire week. We have sessions set up from Monday the 11th all the way through Friday, November the 15th. We have sessions set up from 8 in the morning until 3 o'clock in the afternoon. Okay, they're first come, first serve. So if you plan on doing those, if you plan on doing one live, coming to campus and doing it live, you need to call Ms. Bishop, Leanne Bishop, at 662-620-5380. And she has the sheets that she will, that you can sign up for times. And again, it is on the hour. So 8 o'clock, 9 o'clock, 10, 11, 12, 1, 2, and 3, Monday the 11th through the 15th. And those are first come, first serve. If you do it live, you have to bring your patient with you. We will not provide a patient. So you have to bring your patient, stethoscope. We will have the reflex hammer. We will have the Snellen chart, but you do need to bring patient and stethoscope. Okay, if you're going to video this, number one, don't go out and spend a lot of money on a camera. Phones do perfectly fine. One thing about the phones, they record, today's phones record in very high definition. That looks great. The only problem with it being in very high definition is it can cause it to be a huge, huge file. Sometimes a huge file can take a while to upload to YouTube. So keep that in mind. What I'm saying is, if you're going to turn this in on November the 13th, when it's due at 3 o'clock, do not start the night before on the 12th videoing this and then expect to get it to YouTube. Give yourself a couple of days, because you're going to find that technical difficulties arise. And I've been doing this long enough. It happens every year. People are going to put it off to the last minute, and they're not going to be able to get it to YouTube, and it's going to cause problems. So give yourself at least 3 or 4 days to get all of this done. Okay. Also, as you're videoing, you need to make sure that I can see what you are doing. Okay. So in other words, if it would be best, you don't have to do this, but it would be best if you have a helper, if you have somebody that is working the video camera, so they can move around where they can see. Okay. You can do it perfectly fine with it set up on a tripod. I have them turned in, and they're perfectly fine with that. Just, if that's the case, just be very cognizant of where you are standing in relation to the patient. I have to see what you're doing. So in other words, if you are standing right in front of the camera while you are assessing their mouth and teeth, I can't see what you're doing. All I see is your back. If I can't see what you're doing, I can't give you credit for it. So make sure that you are positioned where I can see what you're doing. When you're assessing the patient's back, make sure they're turned to where the camera can see that. Also, in real life, you don't do this, but for this assessment, I need you to talk to me and tell me what you are doing. Otherwise, I don't know what you're doing. So for instance, when you are looking in the patient's mouth and you're assessing the inside of their mouth, you need to say, okay, I'm assessing the patient's teeth. All teeth are intact. I don't see any missing teeth. The tongue is pink and midline and moist, etc. Tell me everything that you're doing. If not, all I see is you shining a pin light into someone's mouth and looking around. I have no idea what you're assessing, so I can't give you a credit for what you're assessing. So walk me through it. Tell me what you're doing. Also, if you have questions on this, I think we've pretty much covered everything. If you have specific questions, by all means, call me and ask me. Or even better, if it's a very generic question, remember under the discussion board on this, I have the Ask Mr. Calvary. Because if ask the question on there, because most likely if you have a question about something about this physical assessment, there are 25 other students that have got the exact same question. So if you put it on the Ask Mr. Calvary, I will go in and I will answer it there, and other students can get the benefit of your question as well. All right, so that being said, again, you must make at least 85% on this. Video versus coming to do it live. If you're going to do it live, Ms. Bishop, Leanne Bishop, is taking appointments for that now. So those are first come, first served, Monday the 11th through Friday the 15th. I think that should cover about everything. So again, if there is any questions at all, don't hesitate to let me know, and good luck on this.